A doctor reveals 5 silent signs. Your liver is begging you to change your routine. Most people wait for the wrong signs. They wait for yellow eyes. They wait for pain on the right side. They wait for a dramatic diagnosis. But that is not how the most common form of liver trouble usually begins. The liver problem that now affects more than 30% of people worldwide is often metabolic dysfunction associated steatotic liver disease, or MASLD, formerly called NFLD, and in its early stages it is usually a silent disease with few or no symptoms. Many people do not feel anything at all. That is why the smartest way to catch liver trouble early is not to wait for dramatic liver symptoms. It is to notice the quiet metabolic clues that often travel with it, because when the liver is under metabolic stress, it does not always scream from the abdomen. Sometimes it leaks signals into your waistline, your blood sugar, your lipids, your blood pressure, and your routine. And if you know what to look for, those signs can show up long before anyone says the words fatty liver out loud. NADDK says metabolic syndrome traits linked to higher risk include a large waist, high triglycerides, low HDL, high blood pressure, and higher than normal blood glucose or type 2 diabetes. I want to walk you through 5 silent signs. Not 5 guaranteed diagnoses. 5 quiet clues that your liver may be asking for a routine change now, before the damage gets harder to reverse. The first sign is your waistline getting thicker even if your total weight does not seem dramatically different. This is where many people misunderstand liver disease completely. They think the liver is one organ and belly fat is another issue. But metabolically, those stories overlap. A large waist size is one of the core metabolic syndrome traits tied to higher risk of MASLD and MASH, and central fat is one of the clearest routine-related clues that the liver may be dealing with fat overload too. This is not just a cosmetic issue. It is often a sign of the exact metabolic environment in which fatty liver thrives, and that is why I would pay more attention to a slowly tightening belt than most people do. Because a growing waist is not always just getting older. Sometimes it is the body's easiest visible clue that the liver is storing more than it should. The second sign is your triglycerides climbing or your HDL dropping. This one is especially sneaky because people are trained to look only at LDL. If LDL is the cholesterol everyone talks about, they assume triglycerides are a side note. But NIDDK specifically lists high triglycerides and low HDL cholesterol among the metabolic syndrome traits that increase the chances of steatotic liver disease. The American Liver Foundation also notes that MASLD commonly develops in people who have increased body fat, diabetes, high cholesterol, or high triglycerides. So if your labs keep showing triglycerides drifting up or HDL staying low, that is not just a heart health conversation. It may also be a liver conversation. Because the liver sits in the middle of fat handling. And when that handling starts going wrong, your lipid panel often starts whispering before your liver ever starts hurting. The third sign is your fasting glucose or A1C creeping up. This may be the most important sign on the list because the relationship between insulin resistance, diabetes, and fatty liver is so strong. NIDDK lists higher than normal blood glucose and type 2 diabetes among the traits that raise the risk of NASH, and it notes that insulin resistance or type 2 diabetes makes doctors more suspicious of fatty liver disease. NIDDK has also highlighted that fatty liver disease is common in people with type 2 diabetes. That means the person whose sugar is only a little high may already be getting a liver clue. Not because every glucose bump equals liver disease, but because when insulin resistance starts building, the liver is often one of the first places that metabolic stress gets stored. And that is exactly why I do not treat a creeping A1C as just a sugar issue. It is often a whole body routine issue, and the liver is one of the organs paying the price. The fourth sign is your blood pressure rising quietly over time. Again, this sounds like it should belong to the heart, not the liver. But early liver stress is often metabolic, and metabolic syndrome includes high blood pressure right alongside large waist, high triglycerides, low HDL, and high blood sugar. MASLD is not just a liver-only condition. It is part of a broader metabolic pattern. AASLD and Liver Foundation materials repeatedly frame MASH and MASLD as conditions linked to obesity, type 2 diabetes, high blood pressure, and high cholesterol. That is why a rising blood pressure reading should not always be placed in a separate box. If your pressure is creeping up at the same time your waist is growing, your triglycerides are worsening, or your glucose is edging higher, your liver may not be an innocent bystander in that story. It may be one of the central organs in it. The fifth sign is a mildly abnormal liver test or an ultrasound that unexpectedly says fatty liver. This is the sign that finally gets people's attention. But even here, the story is more subtle than most expect. AASLD notes that most patients with MASLD are asymptomatic and often present with incidental labs showing elevated aminotransferases or hepatic steatosis on abdominal imaging. Mild to moderate AST and ALT elevations are typical, but normal liver enzymes do not rule MASLD out. The American Liver Foundation also notes that blood work may show elevated liver enzymes, or imaging may reveal an enlarged or fatty liver. And that is the part many people need to hear twice. A slightly high ALT is not always meaningless. An ultrasound saying fatty infiltration is not always something to shrug off. And normal enzymes do not guarantee the liver is fine. So if you have ever been told your liver tests are only a little off, that should not trigger panic. But it also should not automatically trigger dismissal. Now here is where all 5 signs connect. A bigger waist, higher triglycerides, lower HDL, creeping glucose, rising blood pressure, and eventually an incidental liver test or scan. That is not 5 random problems. That is often one metabolic story being told through 5 different channels. NEDTK's metabolic syndrome description and AASLD's MASLD framing both point in exactly that direction. And this is what I think most people miss. The liver usually does not beg dramatically at first. It begs quietly, through routine link clues, through the body systems you thought belonged to something else. So what should you actually do if this pattern sounds familiar? First, do not self-diagnose from one sign alone. These clues are common, and they can overlap with many other conditions. But if several of them are clustering together, that is worth discussing with a clinician. NIDDK says doctors diagnose fatty liver disease using medical history, physical exam, blood tests, and imaging tests. Second, do not wait for severe symptoms before acting. Early MASLD is usually silent, which is exactly why routine change matters most before things get dramatic. Third, understand that this is one of the liver problems where routine change really matters. NIDDK says treatment centers on regular physical activity, healthy diet, and weight loss. And AASLD materials note that roughly 5–10% weight loss can improve liver fat, inflammation, and fibrosis. So if I had to reduce this entire script to one line, it would be this. Your liver usually doesn't ask for help with pain first. It asks through your metabolic routine, through the waistline, through the sugar, through the triglycerides, through the pressure, through the slightly abnormal labs people keep postponing. That is how the liver whispers before it starts causing real damage.